Eileen, thank you for sharing this with our viewers. Your toenail surgery.
Yeah.
Now, how long has it been bothering you?
About 2 weeks.
About 2 weeks?
Yeah.
Have you had any discharge out of it?
In the first week I did, but then I was on the antibiotics for a week.
And they helped temporarily,
Yes.
but it wasn't the full solution.
No.
Because that nail keeps growing through the skin, trying to get through and causes swelling of the skin past it.
Mm-hmm.
And so it just kind of never ends. You can actually get these sticking out from people's toes a little bit with skin still in front of it, growing out because it gets swollen and gets stimulated to swell up and grow from the stimulation of the nail going through it.
Well, I'm glad I don't have that.
So we will keep it from turning to that by just taking that edge of the nail off. Now I have 2 needles, one that's small and one that's it's still fairly small, but it's able to get in deeper.
Okay.
And we're starting out with the one that's just for skin, but we can actually get down to the nerve with it. So we'll start with that.
Okay.
Ian, can I have you spray by pointing that stream straight right about where my finger is there? I'll direct you once you hit. Yeah, maybe a little bit lateral, kind of in line with the toenail. Yeah, oh, you're right. That's perfect. I'm just going to go in and give you a shot there. You probably feel it going in.
It's all right.
And then we numb it up. I'm using bupivacaine, a local anesthetic. And that gives us a good start. I'm numbing up the nerve as it goes in. I'm going to recap that carefully.
How's that feel?
A one-handed recap.
Hurts.
Yeah?
Yeah.
Is it still hurting right now?
A little bit.
Still stinging?
Yes.
We're even going to give you more anesthetic. Right about there, where the toenail is. Did you feel that?
Yes.
Let's put in some more anesthetic. The bupivacaine, almost can't say it, works a little more slowly than the lidocaine. So we're okay with giving it some time to work.
Mm-hmm.
Is it still hurting?
Yes.
Stinging?
Yeah, a lot. I'm okay with it, but it is. I know when I had it done before,
Yeah.
they thought it was all numbed up and they had to give me more.
That's quite often what happens with this procedure. I'm hitting the deeper nerve because there's 2 of them.
Yeah, it hurts.
One at the top of the bone and one at the bottom of the bone.
Okay, good.
And the more medicine you put in, the better. There's a lot of medicine in there.
Okay.
So we'll let that do its thing.
All right.
And can I have another alcohol wipe? I'm going to numb up some more even.
All right.
Do you feel when I'm doing this up here?
Yes,
Completely? There's no numbness or anything?
I feel it.
Okay.
Yeah.
All right. And would I be able to get you to spray right in that corner of where the nail joins the, yeah, just that right there. Is that cold?
Yes.
Okay. Then when we see it start to frost up, take it away. There. See what I mean?
Yeah.
You know it when it happens. Are you feeling stinging?
Yes.
How bad is it?
That's not too bad at all.
We just saw a blanch across the nail there because the medicine got there and it's helping us out. Still hurting?
Yeah. Yes.
Is it getting worse?
Yes.
Okay, I'm going to let off the pressure. I'm going to take that out. And I'm going to check for sensation. Can you feel sharp over here?
No.
Okay, I'm going to give you another injection. Did you feel anything?
No.
Then you must be numb. Because that would have hurt if you weren't numb.
Okay, that's good. All I can feel is a little pressure. I can feel
Pressure?
sharp. Yeah.
Can you feel sharp here?
No, I can feel you poking, but nothing other than
Okay. Does that hurt?
no.
Put in a little more medicine.
I feel that.
Does it sting?
Yes.
How badly?
Medium.
I'll keep pushing, but I'm pushing very slowly.
No, No, you do what you gotta do.
And then can you feel poking here?
No,
Here?
no,
Here?
no.
I'm getting the idea that,
I feel that's a little sharp.
okay, we're going to give you a little more medicine there. Little sharp.
But yeah,
Okay. Well,
mild sharp.
if you describe that as mild sharp, there is definitely partial anesthesia
Okay,
in
good.
place.
Okay.
Yeah, I think if you were to see this and when you watch the video, yeah, you'll say, yeah, that definitely there was something helping
Okay.
if that was just mild or moderate.
Okay,
Still doing okay though, huh?
yes.
Pushing kind of hard here.
Okay, it doesn't bother me at all.
And down here again. Are you feeling anything at this point?
A little sharp. Yeah, not sharp.
Not sharp. Anything?
No.
Here?
No.
There is a technique that's used with this sometimes. I don't know how much this interests you or not,
No, it
but
does. It does.
we'll put an elastic band around the toe
Okay.
and tighten it just for the procedure, and then we'll take it off when it's done. But it allows us to limit bleeding during the procedure.
Good idea.
And we do that because we can't use a medicine called epinephrine in the toe.
Yeah, I know what that does.
Yeah,
Is that because it's so peripheral you don't want to?
correct. Yeah, you don't have the enough circulation from other places. So you can do it in the nose, but tips of the ears, fingers, toes, penis, these are organs that you don't want to put that medicine in because it's limited blood supply and you can
Okay. Good to know.
have things get injured. Just gonna dab this with a sterile gauze.
She's finishing up with her new patient.
Okay.
She'll be right over as soon as she can here.
And I'm looking at the coloration over here on the side. You may have noticed that yourself. There's some color. And
You mean the red and the looks like black almost?
yeah, well, now it's more of a tan or brown. Was that there before?
No. I mean, that's been there since I noticed my toenail was hurting. But I don't recall that discoloration in the past.
Trying to think of a way to, we may want to do a specimen just so we can get a piece of this colored. Do I have a, we're going to do something unique. I don't like this pigmented area next to the toe.
Yeah.
And before I thought, oh, maybe that's just a little bit of scab or dried blood from when it was draining. But now that I look at it, it looks like it's actually a pigmented skin lesion. And I get a little nervous about pigmented skin lesions around toes. They can actually appear in the nail bed itself, and you'll see some color through the toe. And we've had one that we sent off, and it turned out to be malignant melanoma, which is a deadly type of skin cancer. Not that this is strongly suspicious for that, but I think while we have your toe numb, why don't we just, if we can, shave that completely off. So first, we separate the nail. Am I hurting you?
No.
With combination of sharp and blunt dissection. Sharp being as we go in and blunt as we separate the parts of the scissors. Still okay?
I'm fine, thank you.
This is something that, without anesthesia, has been used as torture in some.
I would spill all the beans if I didn't have.
Yes. Where are the Allies landing?
Gosh, I often wonder sometimes if I was tortured.
Oh, isn't it an awful thought?
I just can't imagine.
Yeah. Yeah, that's why they wouldn't even tell some people some things.
I can understand.
Are you doing okay?
Yeah.
Because you're the one that had to sit down last procedure.
I know.
I'm glad he didn't forget
This
about
isn't
you. Well,
The last one was rather bloody.
was it a toenail or something different?
It's a back.
Yeah.
Oh. See, if this was somebody else's toe, I'd love to watch, but not when it's my own.
Oh, I hear you.
Right, yeah?
Yeah, if it's someone else, sure, I'll watch.
Yeah, watch.
A lot of times in the past, we'd actually immediately stick the nail, well, not immediately, we'd clean it up a little bit, but stick the nail back in where we got it to act as a bit of a splint
Oh,
to keep that open for the new nail. Actually, it doesn't stick around long enough for the new nail because it takes 6 months to grow a nail.
oh, interesting.
But just, to take it home and
You
it's,
don't do that anymore.
I still sometimes do, yeah, just to have something there while it starts healing. Okay, that colored portion, it's coming out.
Okay, good. Is that in the skin?
It is the skin. It's the edge of the. Yeah, got it completely. So
Good.
we'll just find out. Yeah, well, you're already numb, and that thing's a little suspicious. Let's just get rid of it.
Yeah,
No better time.
thank you.
I mean, if you've already been numbed up there, did I get the whole thing? Yes.
Good, thank you.
Oh, absolutely. You're welcome. This was beautiful. We didn't even use a tourniquet. Certainly we didn't use epinephrine, and you're just not bleeding.
Awesome.
Wow, this is wonderful.
I'm doing my best for you, Doc.
Well, except now I'm starting to wonder if you have bad circulation.
Uh-oh. Oh, no.
Is that-
You know,
is that why this is so
been
good?
told that. I don't have it in the family, hopefully not. I mean, my toes feel cold right now, but it could just be because my sock's off.
May I have some Aquaphor squirted out?
Yes. Let me see.
Man, I even did the biopsy and it's still not bleeding.
Well, it's your technique.
I can't take credit for that.
No?
I'm not that good. Just squirt it out. Just make it land somewhere if you can.
Oh, it's sticking.
Shake, but not so it gets all over me.
Okay.
I once heard you're allowed 3. 1, 2. Oh, that was something else. Never mind. All right, here we go. Anatomic or physiologic splint. I've heard it called both. I think anatomic makes more sense. So I'll just put it there. When it falls out, that's fine.
Okay,
It has to get out of the way for the new nail growing out anyway.
so if I just take a shower and do all that, it won't come out, or it will? Or...
Oh, it probably will, and that's fine.
Okay.
I do ask that you not shower for a day.
Okay,
Give it a day, at least a day.
okay.
Yeah.
So you already cut the toenail?
Surprise.
Wow. I didn't feel any pain,
Well, you felt some when I was initially
just the injection.
numbing you up.
Yeah,
So we'll put a little dressing on that. We're going to send off that little piece of the skin for a biopsy. And as far as pain, that nail's just not going to stay in there. That's fine.
okay.
We'll still put just a little bandage on is all it needs.
Mhm.
If it doesn't even make it till you get home, that's fine. It really
Okay.
doesn't have to be there. I just like to
Yeah,
have something help with bleeding, and we cleaned it off, so it shouldn't be introducing infection.
okay.
We do want you to keep an eye out for signs of infection, for redness around the toe, for pus discharge, red streaks going up the leg, fever,
Okay,
increasing pain. It'll hurt a little bit, but
yeah,
just over-the-counter Tylenol will be fine
yeah, okay.
for this.
Awesome, thank you.
Yeah.
Really appreciate it.
No, we're glad to do it. Thanks for joining us. And Eileen, thank you so much for sharing your procedure with the viewers. We want to thank you, but also thank our patrons, BooBoo Kitty, Lindsay Antoine, and Petra Rosenberg. Thank you, ladies, for helping make this possible for people to be able to watch these videos. And until next time, Eileen and Dr. Mark Vaughan telling you to stay in good health.